how early is traumatic brain injury something that you have to really consider when thinking about enrolling your kids in these sports?
Knowing the dangers that I've seen, I would not feel comfortable with my kids playing football. But, at the end of the day, it's a discussion that the parents have to have amongst themselves, right? My job is to inform you of the risks, and then you kind of make that decision.
So, Dr. Patel, you have, we were talking earlier about your experience with neurology in sports. Mm-hmm. Tell me a little bit about how you got started, the fascinating things that you did after you got started and all that stuff.
Yeah, absolutely. So, when I was in medical school, I was trying to figure out what I wanted to do with my life, right? Pretty common decision that most med students have to go through. And I always liked sports. Growing up, I was grew up in Dallas, huge sports fan. Being a Cowboys fan is kind of rough at the moment, but it was fun.
Yeah.
And so, I grew up loving sports, so I wanted to do something, but I really fell in love with the field of neurology, right? And, during my third year med school rotation, I really liked neurology. So I wanted to do neurology, but I was hoping to do something with sports. And if you
from the beginning, you always wanted to do something with sports.
Yeah, absolutely. Because that's where my passion was, right? Yeah. So I was thinking sports medicine for a long time. But if you watch the NFL and you know all about these concussions and stuff that was happening, this field of sports neurology was burgeoning at the time. So I went into my neurology residency at UT Austin, Dell Medical School, with an open mind. And, they really gave me the freedom there. And I want to thank them for that, obviously, to kind of explore what I wanted to do.
Yeah.
And so I got to shadow with one of the family medicine doctors who was covering the Austin Bold at the time. That was a minor league soccer team that's now closed down, but our hospital system was contracted with them. So I got to see them kind of operate and then got to be on the field for that, which, as a kid growing up, that's like your dream, right? Getting to go on the field. And so then obviously that furthered my interest more. And so when I was looking at fellowships, there's only, for sports neurology or brain injury neurology, there's only like 6 or 7 of them in the country. It's mostly a PM&R specialty, brain injury medicine.
What's that again?
Physical medicine and rehab. Okay. So that's a separate specialty that, med students go into. And so, they do a lot of sports medicine, but also brain injury as well. But there was this burgeoning field of sports neurology because it's like, your people are suffering from a brain injury, right? And that's obviously the brain and something neurologists should deal with. So I looked into those and I applied and I got accepted to the one at the University of Florida out in Gainesville under Dr. Michael Jaffe, Carolyn Geis, and Jay Clugston. And I spent a year there doing fellowship. And the coolest, one of the cool things about that was the connection to the University of Florida and their athletic department. So Dr. Clugston is the head team physician. So myself and my co-fellow, we got to split the University of Florida home games and go out there with the sports medicine fellows and be on the field, which, again, as a kid growing up, that's the coolest thing ever, right?
Absolutely.
That was the year that they played Alabama that year. It was 2021, I believe. And, we're the sports neurology fellows, we were on the sidelines, on the visiting team sideline. So, I've got Nick Saban, who's like, the god of college football, running by me on the sideline. And, it's just like, wow, this is what it's all about, right? And so that was a very, very cool experience. Obviously, the sports part was just a minor part of the fellowship. The much bigger part was, seeing everyday people like you and me dealing with traumatic brain injuries. But, it was a very, very cool experience. And, we not only concussions, but it also taught me the value of neurology in sports because, whenever people have sports injuries and they're neurology related, they immediately think, oh, this must be a concussion, right?
Yeah.
But a lot of our athletes suffer from other issues as well, right? So, especially in our women population, migraines are very, very common, right? And, high level athletes, obviously they're going through a lot of stress at the time. And, and it doesn't have to be just women. Men obviously suffer from migraines too, but migraines can really get set off by high stress. And so, a lot of my athletes, they've never suffered from concussions, but they deal with migraines, right? And so that's something that I can help out with. And I was taught how to do that at the University of Florida.
So is that considered a traumatic brain injury? Because for those of you who are just tuning in, Dr. Patel, we just jumped right into it because we're having this great conversation before the cameras started rolling. But Dr. Patel is a specialist. He's a neurologist, and he specializes in TBI. Mm-hmm. So do migraines and TBI have a connection? together?
That's a great question. So, the vast majority of patients will not have had a history of traumatic brain injury, right? Migraines happen in a number of individuals, most commonly idiopathically, or if they have a family history. So, the most common risk factor, I would say, and it's not really even a risk factor you can control, is a premenopausal young woman, right? Because, well, we're not sure why, but most likely because of the hormone fluctuations, they tend to be at the most risk of migraines. And, obviously the vast majority have not had a history of TBI. But if you do have a history of traumatic brain injury, which is, some kind of external force that's applied to your head, that kind of damage can lead to headaches, unfortunately, and that can be very debilitating for people, especially, people that already have a pre-existing history of headaches, and doesn't have to be just migraines per se, but also like tension headaches. That can certainly lead to worsening of it, but it can also cause it to pop up in people that do not have a history of it as well. Mm-hmm. And that can be tough to treat as well, as far as like differentiating that and all that as well.
So would headaches be one of the most common symptoms of a TBI?
Mm-hmm. Yeah, so that's a great question. And so we get a number of symptoms within traumatic brain injury. In my practice as a neurologist, headaches are, I would say, by far the most common, actually. Mm-hmm. There are some that are fairly common as well, but I would say headaches tend to be the most common for sure.
Yeah. Speaking of symptoms, and I know headaches aren't always the symptoms that come out of TBI. You've heard of, professional athletes. I think, was it Junior Seau or something like that? Yep. And I could be wrong. But I believe he passed away due to death by suicide. And I think some of the studies that came from him, I think his situation brought light to a lot of brain injury that was happening in the NFL. Is that right?
Yeah.
Can you talk a little bit about the other symptoms like the depression? Let's touch on that.
Yeah, absolutely. So Junior Seau was definitely one of them. The most famous one, if you've ever seen the movie Concussion with Will Smith, was of Mike Webster, who was a offensive lineman that played for the Pittsburgh Steelers in the 1970s and just progressively declined after he retired. And then he also ended up committing suicide as well. And then this pathologist, Benito Amalu, who was played by Will Smith in the movie, examined him under the microscope and found these abnormalities that were seen. And that kind of started the whole push towards CTE, or chronic traumatic encephalopathy.
Now, were these abnormalities, was it tissue damage or what was it, vessel damage?
Yeah, that is, buildup of certain proteins, so tissue damage that you can see under the microscope. Mm-hmm. And so that's when you see now all these NFL players that have come out and have been diagnosed with it post-mortem. And so that's been a tough thing for, our sports community to kind of diagnose, because the one full-on way to diagnose it is by looking at someone under a microscope, right? Well, that's great because you can diagnose it, but then how do you diagnose it in living people, right? Because the only way you can do it is if someone passes away, then post-mortem you do a brain biopsy. So we're starting to now develop these new criteria for TES, or traumatic encephalopathy syndrome. And that is looking into diagnosing kind of the symptoms in a living individual. So, kind of what you were talking about, cognitive is one of the hallmarks, right? So cognition is something that people decline in terms of the way that they think, right? So memory issues, for instance. But also mood abnormalities as well, right? So depression, anxiety, psychotic symptoms, stuff like that. So those are symptoms that you can also see in the category of TBI that does not meet criteria for the CTE or TES.
Wow.
Yeah.
And how far after the TBI do these symptoms usually occur, like the mood disorders or the headaches, stuff like that?
Are we talking about just, kind of in the general population? Or?
Yeah, well, let's talk about, let's keep it with the sports.
Sure.
You have someone who played high school football or college football, and they've had multiple concussions. About how long after that event do these symptoms usually come about?
That's a great question, and it's really variable. It could be years or even decades.
Okay,
down the line.
So yeah. I guess the reason why I ask this is because I think it's important for the listeners to know that just because you had a TBI and you're fine a year later, it could progressively come on, right? Or it could have a later stage onset.
Well, yes and no. So yes, in the sense of if you've suffered multiple TBIs over the course of time, or, multiple subconcussive hits. And what I mean by subconcussive hits are, if you watch football, you imagine these offensive linemen are hitting each other on a day-to-day basis or a play-to-play basis. And it's almost like a subconcussive hit in that it's not a full-on, hit, but it's almost like if you hear these athletes talk, they're talking about almost being in a car accident after each play, right?
Yeah.
And so the accumulation of those obviously does build up over time. Now, if you've had, one concussion and you've recovered appropriately from it, I in that case, I told my parents or my patients not to, worry because, you've recovered appropriately. Now, the biggest thing you can do for yourself is preventing the second one from happening, right? Now, people are going to hit their heads, right? That's part of life, right? You're going to, odds are you may get into this car accident, or, you may trip over something and fall and hit your head. You can't control that. But putting, leaving yourself out of situations in which you're obviously prone to getting hit, right? Such as, for instance, if you're doing boxing, for instance, right? I mean, that's something recreationally that you could probably avoid. Now, am I going to tell you to go avoid it if that's your passion? No, right? But, knowing the risk factors of it can certainly...
And taking the extra measures to protect your head. Yeah.
Yeah.
So this is super fascinating, the conversation that we were having before the camera started rolling. The sports part, we didn't really necessarily touch on that whenever you and I were talking about doing this.
Sure.
And you're telling me about your experience with sports. So I thought that this would be a great topic to touch on first. So staying kind of in line with the sports theme, how, if a parent is listening to this and they have a 10-year-old, 11-year-old wanting to go into full contact sports, whether that be girls doing soccer, because we all know that soccer is they have concussions as well, to, little boys wanting to join their football, their team football or their school football team. How early is traumatic brain injury really something that you have to really consider when thinking about enrolling your kids in these sports?
That's a fantastic question. And I get that question a lot from parents. The most common question I get whenever I'm seeing a younger child, or, I'm an adult neurologist, so I see mostly above 18, but I do also see younger kids that are athletes, right? And I get that question fairly often is, would you let your kids play the sport, right?
Yeah.
And so, my wife and I, we don't have kids, full disclosure, not yet, but we've had this discussion before. And as far as football is concerned, I would not feel safe having my kid play that. I'm a huge fan, so that may make me a hypocrite, right? And my wife brings that up all the time, is that how can you watch these people every Sunday while knowing the dangers of it? And that's a fair point, right?
Yeah.
But just, knowing the dangers that I've seen, I would not feel comfortable with my kids playing football. And it comes from a unique, ethical perspective, right? And I've had this discussion with other neurologists in the past as well, is that, right? Imagine this child that comes from an inner city family, right? Not the most financially advantaged place in the world, but they have this unique gift to play football, right? And, they could be like a star wide receiver, a star quarterback. And, from a social ethical perspective, this is their one chance to get out of that, right? And, is making it big. Well, then it comes up from an ethical perspective. Who am I to tell you that you can't go and do it, right? This is your one chance to get out of it. So what I typically tell people is, if it was my kid, and this is just from me talking, if it was my kid, I would not let them play. But, at the end of the day, it's a discussion that the parents have to have amongst themselves, right? And, at the end of the day, my job is to inform you of the risks, and then you kind of make that decision on your own.
And even going, I think it's even more socio-economical. What about, if a kid has a passion that they cannot think about anything else but whatever background they come from, to squash a kid's dream and hopes is, I imagine, really devastating. And so I think you're right. There's these things that you have to juggle, these things that you have to consider when, leading a kid into a different area, and ultimately it's a family's decision.
Yeah.
But yeah, that raises I have two daughters who are more interested in theater and music. There's not very many concussions, I don't believe, that come from that as relative to other sports.
Well, you could still fall on a theater, right?
Yeah, right. They'll probably get into ballet and do the jumps, and I'll be eating my words. I hope that's not the case,
right.
But
definitely.
But yeah, I think it's a family's decision, but that is an interesting conversation to have, though. I think is what's the ethical decision there whenever you have it could raise someone out of, it could better their lives economically, financially, it could taking their dreams away could hurt them in other ways mentally. And so what do you do from there?
Yeah. That's a fascinating question, right?
Yeah.
And that's something that's very, very hotly debated within our community, for sure.
And do you think that the NFL and college football and even high school are moving in the right direction to help protect these players a little bit better than they have, say, in the 90s?
I think so, for sure, because I think a lot more has come out about the dangers, right? And so, after I graduated from the University of Florida, I worked at Vanderbilt for the last couple of years before moving to San Antonio. And Vanderbilt, they have their own sports concussion clinic, but the NFL's, I believe it's the CMO, or the Chief Medical Officer, Alan Sills, is neurosurgeon faculty at Vanderbilt. So I got to see, some of the insight from talking to the physicians and the neuropsychologists that work within the sports concussion clinic about the NFL's, protocols and what they're doing. And it's really unique because, and it's very important too, I think what they're doing is they have spotters on each sideline that are monitoring people for concussions, or, if they saw someone pretty much get their head hit. And then they also have people high up in the sky in the booth as well. So it's cool because if any one of those people sees someone like acting up, they can page the referee directly and pull the player from the game, and then have them examined by the NFL's independent person, that spotter, and also the team physician as well. And so at that point, there was a player yesterday in the AFC Championship game for the Bills, right? I think his last name is Bamford, but he was a cornerback, and he got his head hit, and he had actually just had a concussion the previous week, and so there's a controversy about if he had been cleared too quickly, but my understanding is they probably saw that, pulled him out of the game, did the testing, and then within a couple of minutes they had already ruled him out from a concussion. So the process is actually very, very smooth from what I've heard. Now, again, I haven't been on the sideline, so I haven't viewed it directly, but I do think that the NFL is taking it seriously. And then, it's a top-down effect, right? Because the NFL is taking it seriously, college football is taking it seriously, and then high schools are as well. Resources do become an issue, right? I mean, the NFL and college football have tons of money that they can put into it, whereas your high school district may not. But the high schools do have a physician on the sideline for each team that covers the games. And, they are sports medicine trained, so they do know how to do the concussion protocol as well. So I think that's been good as well. When I was in high school, granted I didn't play sports, but when I was in high school, from 2005 to 2009, that's not as much, you didn't hear as much about it, right? And so I think the high schools are moving in the right direction, and, each district or state has their own return to play protocol too, just to make sure that athletes are safe to go back as well.
Yeah, I think it's, you can say all you want, oh, come on, toughen up, you hear that, but these are real things. I think the junior SEAL was a good eye-opening, and you don't necessarily have to stop football. I don't think that's where we're going. I think just putting up and protecting these athletes just a little bit better it just makes sense.
Yeah, I think so too. I mean, part of the problem is it's a physical sport, right?
It's a physical
sport. I think, you're never going to get it out 100%, right? And so, and another issue is these guys are wearing helmets that kind of act like weapons, right? And so the NFL, and college football in particular, I'll give them a lot of credit with this whole new targeting rule where, if someone's taking a headshot or something like that or aiming for the head, they'll just eject the player out of the game. And so, you are trying to make it safer. The question that I always come up with is like, how safe can you make it? Right. You could take their helmets away, but then, the helmets do have value in terms of protecting someone from like a skull fracture, right? And so then you may have more neurosurgical issues, right? And that's a danger in and of itself as well. So the NFL, college football, I think all football leagues are in a tough spot as to how do you make it safer, right?
Yeah. I think I'm a Denver Broncos fan,
right?
And I can't remember what play it was, but there was a helmet-to-helmet contact, and you could tell that it was unintentional. As far as my opinion, it looked like it was unintentional, but he realized that he did it, and he immediately he put his hands on his helmet, like, I know I just had a flag. So I don't think it's making them any more timid, because I think you can still be aggressive and lead with your shoulder as much as you can with your helmet. But I think that it's always in the back of their mind now is good for them and the other players, because I just think, the helmet to helmet thing, really, if you've seen a big time hit helmet to helmet, it doesn't look great. And so I do think, going back to what you said, how safe can you make it? You can't take it completely out, but I think as long as these young men are trained and conditioned to hit properly, and I did play sports in high school, and football was one of them, and we were trained on technique, and so it's not like you're adding this new technique to their tackling style, and it's going to throw them off, and it's going to make them timid, and it's going to make them get hurt more. No, it's just adding more to the technique of hitting properly. I think that's fine.
Yeah, I think so too. I mean, and that starts at a young age, right? Yeah. I'll give you a story. One of my med school classmates, he was telling me this story about, he played high school football, right? And his coach at the time told him, okay, at the snap of the ball, I want you to ram your head straight into the opponent's chest. He's on the line, right? So defensive lineman, and he's like, just ram it straight into the opponent's chest. He's like, absolutely not. I mean, and so I think it is very subjective on what a coach teaches, but I agree with you in that the earlier that they start teaching proper technique, right? And, that starts in Pee Wee football, right? Once they transition from flag to tackle, because they're playing tackle football with elementary school kids nowadays, right?
Yeah.
And so, you have to start teaching that at a young age in order to get it done properly.
Right? Yeah, absolutely. And I've been clocked before.
Yeah.
There was this running back, and he was a beast. He was a man among boys. My freshman year in high school, and I didn't tackle him properly, and he bent his head down, and we went helmet to helmet.
Yeah.
And it did not feel good. And if I would have known how to tackle him properly, I could have avoided that. And I don't think it would have put me in a position for me to get hurt if I was going to tackle him properly.
Yeah.
I don't know. But I think that's a unique discussion that I truly can hear both sides of the argument and understand what each person is coming from.
Yeah, absolutely. Yeah. Yeah, and it's tough, right? I mean, and that's a discussion, again, going back to the parents, right, is that each family needs to have that discussion with themselves. Because, even if you tackle properly, odds are a concussion is still going to happen, right? Because you're being taken down to the ground, and, you can hit your head that way too. So, there's no way to prove this. I'm sure most premier NFL players have suffered at least one concussion at some point in their life just as part of their job. And, maybe it wasn't diagnosed or whatever, but, there are risks to it, obviously, right? And so it's your risk-benefit tolerance, and figuring that out is one of the toughest things that families have to go through. So
going to what you just said, like the severity of these hits that actually cause a traumatic brain injury. And I think you said even a micro hit or getting hit multiple times that are just right below the threshold of a TBI is also problematic.
Right.
What is the severity of the event to the head that can cause a TBI? Does that make sense?
Yeah. So, I mean, if we're classifying TBIs, there's 3 types, right? So, there's mild TBI, moderate TBI, and severe TBI. The vast majority of TBIs are mild TBI, right? And a mild TBI, for better or for worse, is synonymous with the term concussion, right? Which we've been talking about. And so a concussion can be caused by numerous things, right? So, I mean, we've been talking about athletes, obviously, so athletes can get it. But the vast majority of patients that suffer from concussions are not athletes, right? So think about, the older individual that, doesn't feel as well as they used to in their feet and then miss a step, fall, and hit their head, right? A lot of them that I see in my practice are actually patients that have been involved in a car accident, right? Oh, wow. And, from a car accident can happen from a number of ways. You swing and you hit your head against the window, airbag comes up straight in your face. The other one that I see quite often within a car accident is whiplash, right? Because your neck kind of swings forward and then comes back, and that can lead to a concussion as well. Within our military population, blast injuries, especially for those that fought in Iraq and Afghanistan, is a very, very common form of mechanism that we see as well. So it kind of depends. There's not per se, I mean, the way I would say it is there's like an endless limit of ways in which you can suffer a concussion, right? I mean, as a doctor, again, I've heard of like everything, right? At the University of Florida, we used to see college kids in our concussion clinic, and well, what was their story? So they were sleeping on their bed, and their bed is about 6 feet above, and they just happened to roll over and fall and hit their head, which, is a way to do it too. Yeah. I've seen people that were pulling something out of their car and then, pulling something from the bottom of their car, come up and smash their head against the top of their door. Mm-hmm. So, I mean, there's so many ways. There's not necessarily a threshold as far as how hard something has to hit to cause it, but if you name a story, I've probably heard it. We've had at University of Florida, we've had hawk attacks lead to brain injuries. Yeah, there was a hawk that was nesting, and so there were some students that got too close to it, just walking. And the hawk obviously, sensed danger and attacked them. So,
wow.
Yeah.
And caused a concussion.
Yes. Yeah. It's scary, And, we always talk about athletes because athletes are the ones that get all the notoriety, right? They get in the media. But again, the vast majority of patients that suffer from concussions are not athletes, right? They're everyday people like you and me that, got into a car accident or fell and hit their head, and I think that's a patient population that's very traditionally been underserved within the neurology world.
Yeah. Let's talk about what a concussion is.
Sure.
Let's talk about, what defines a concussion.
Yeah.
Let's talk about, the treatments for concussion, stuff like that.
Yeah, sure. So, within the context of traumatic brain injury, a traumatic brain injury is an external force applied to the head, right? And so when we define concussion, it's a form of mild traumatic brain injury. Now, the vast majority of times, concussion will be a clinical diagnosis, right? So there's not, there are forms that you can fill out that, have had standardized forms. So for instance, the Ohio State University has a TBI form that you can fill out that can help diagnose a patient with a concussion. In my practice, and in the vast majority of other neurologists that deal with concussions, it's typically a clinical diagnosis, right? Someone hit their head in a certain way and then had a number of symptoms afterwards. So that's kind of gets into the diagnosis. And, people oftentimes ask, do I need an MRI or a CAT scan? Well, if you go to the ER, they have specific guidelines for which they'll decide if you need one of those. More often than not, they'll get a CAT scan because ER is about getting people out of the building, and CAT scans are much, much quicker, right? So they'll get those, and more often than not, it'll be normal, right? And so I tell people that too. If I'm seeing someone and it's within the first 3 months of them having had a concussion, I will rarely get an MRI because more often than not, it's going to be normal. A lot of people with concussions, and what typically, again, this is just my experience with patients, they'll typically get better within the first 3 to 6 months. And so that's part of the reason that I tell people whenever I see them in clinic, medical care is very expensive as is already in this country, right? So, do you really need to spend, a couple of grand on an MRI when it's not really going to make a difference? Probably not. Now, if a patient is very adamant that they would like an MRI, I'm not going to be one to say no, because obviously, it can be indicated in the right setting. You hit your head. I mean, that's a valid reason to want one. But what I typically tell people is it doesn't really add much information, especially in the early settings when one is going to get better. Especially if you've already been to the ER and you've had a normal CAT scan, then, an MRI is not really going to add much to it.
And so a concussion really is, physiologically speaking, it's the brain going and hitting the inside of the skull, right? Maybe creating. Now, bruising, I don't necessarily would be the right way to put it, or is that the right way to put it?
So you can see bruising, and that's kind of the one finding that you can see is you can see a little bit of blood at times, which will be cause bruising. Again, that's the vast minority of patients in which you can actually visualize it. And it's not something we even do anything about that because the blood will kind of either just reabsorb or degenerate on its own. But you can see that as far as bruising. Now, the changes that happen within concussion, as far as our MRI capabilities currently, it's hard to visualize, right? And that's why more often than not, they're on a microscopic level, which is too in-depth for us to see.
And so they're hitting their head, going over through like a case study or something. They're hitting their head, and, the momentum of their head, their brain is continuing. It might hit the front of their head. Is that right?
Yep.
And then maybe even hit the back, come back and hit the back. And that's where you're seeing these injuries on the brain?
Yeah. Well, if there is something, right? Okay. And so, again, the vast majority of the time you won't see anything on the brain, but it's called almost coup-counter-coup, if you've ever heard that term, right? So kind of flip forward or flip backward and then flip forward, depending on which direction the hit comes from. And that's where you can occasionally see the bruising. Yeah.
Okay. And so for people listening who maybe they are, searched this on YouTube and they saw this and they're trying to understand TBI because they had one, what are some things that they can, we'll wrap it up with, what are some things that they can, do to just make sure that they are living out a healthy life with this event in their history? Do they need to worry about anything? Do they need to get regular checkups? What are some of the things that they can do to make sure that they're just going to live a healthy, normal life after this event?
And I will say, that's where a neurologist comes in, right? Even if it is just a one-time checkup, I always encourage patients whenever you have a history of a traumatic brain injury, just to see a neurologist, right? And, most insurances will cover a specialist visit. And, especially if it was years ago, it's not an urgent thing, but just to see a neurologist, just to go, get a full neurologic exam. And then, if you are having any symptoms of it, they can kind of help talk you through different treatments, right? And, they may suggest that you're doing great, in which you don't have to do anything. Again, good, but you've gotten that clean bill from the neurologist at least. But if you are suffering from some of the effects from it, then yeah, absolutely. I think it's even more worth it to see a neurologist, right? And specific effects are headaches, but within headaches, also neck pain, dizziness or vertigo. And vertigo is kind of when everything's spinning, right? Cognitive trouble. So trouble thinking, trouble with memory, trouble with short-term memory, psychiatric issues. You may be better off seeing a psychiatrist, but if you're having mood issues with regards to that, with regards to your brain injury, that's definitely worth seeing a neurologist for. And then also sleep difficulties as well. Sleep is one thing that I personally prioritize in all my brain injury patients, because I find that if your brain is already in this hyperactive state because of this injury that you've suffered, especially in the early setting, like think within the first couple of months, then if you're not sleeping properly, you're just worsening that, right? Because your brain's not getting a chance to rest or anything like that. So it's kind of like your brain is already running on fumes, but then you're not giving it the proper chance to recover. So sleep is one of those things that I think is very, very valuable. Even if it's not a neurologist, just talking to your primary care physician about is a good thing as well.
Yeah. Well, I appreciate this conversation because, especially with the sports aspect of it, these are hot topics.
Sure.
These are questions that I know some of my friends are dealing with when they have younger children. They're trying to figure out if they're going to put their kids into sports. And I think, the idea of, hey, it's the family's decision. You just make sure you understand the risks, understand what could potentially happen and how it could affect them if you keep them away from sports, because you never know what that could do too. So just keeping an open mind and really thinking of all the angles, I think is probably the best way to do it.
Yeah, absolutely. And I say this about any medical condition that that anybody could be going through that's listening to this, right? It's never hurtful or harmful to get more information, right? Within medicine, we talk about informing, right? And so we try our best as doctors, but, if there's something that you see that you find interesting, there's never any harm to bring it up to your doctor, right? And, your doctor may say, no, this is not, it's not going to be something that's going to help you, but great. You've done your own research, and presenting it to your doctor is never a bad thing, right? And, what's the worst they're going to do? They're just going to say no, right? But, at least at that point, you're kind of getting all the bullet points checked, and you're feeling more comfortable with your decisions about anything.
Absolutely. Well, Dr. Patel, let's have you back on.
Okay. Yeah, I love it.
As a matter of fact, we're going to let's record episode 2, and we'll put that out later. We've got more stuff to talk about.
Yeah, absolutely.
I'm super excited to continue this conversation. For those watching and listening at home, please tune in to the second episode with Dr. Patel. That'll probably come out in a few weeks after this. So, Dr. Patel, thank you so much for coming by.
Appreciate it. Yeah, absolutely.
And let's get on to episode 2.